What are the facts about whether it is safe for children to receive the COVID-19 vaccine? Two Kansas City leading infectious disease experts join us to break it all down. I'm Christa Dubill, and Blue KC is proud to bring you the COVID-19 Vaccine Safe series. Community leaders and health experts show how the COVID-19 vaccine is not only safe, but also simple, accessible, free, and easy. We are pleased to have two special guests with us today. We have Children's Mercy Kansas City. We have Dr. Angela Myers, the Director of Infectious Diseases, and Dr. Barbara Pahud is the Director of Pediatric Infectious Diseases Research. So thank you to the two of you for being here today.
Absolutely.
Let's get right to it. First of all, why do you recommend that children receive the COVID-19 vaccine if they do or don't have health issues?
For us as infectious disease physicians, any disease that could be prevented by a vaccine should be prevented. There is no need to have any unnecessary childhood death, especially if there's something that we can do about it. COVID has disproportionately affected adults, but children can still be impacted and have long-term health consequences from it. So developing a vaccine to protect them is definitely a priority for us.
So from the research perspective, for sure. What about you, from you, Dr. Myers?
Anytime you can save a kid from getting an infection that's unnecessary, as Dr. Pahud mentioned, is important to do. I have two teenagers, both my kids are vaccinated. It was very important for me to be able to get them the vaccine as soon as it was available for them.
So I know a lot of parents have a question. If my child has had COVID confirmed, do they still need the vaccine?
That's a great question. Yes, they do. Adults who have had COVID, kids who have had COVID, still need to get the vaccine. You develop some better antibodies or immunity from having had the vaccine than just having COVID disease. So it actually is beneficial to have the vaccine after having had COVID. You have a much better immune response.
I would imagine you both hear it often that there are people that are fearful of the unknown, the concern for their children. Is it safe? So I asked the two of you, I would imagine I know your answers, but what do you say to the parents who are rightly nervous about something moving so fast and so new for the country and the world?
Well, I think the first thing is that they are right to be afraid. We are parents, that's our job, to be afraid for our children, to ask the right questions. And the first step that I usually do is understand why. If you understand why, then you can better address their issues correctly and inform them so they can make an informed decision. But it's our natural, superpower as parents to worry about our kids. So there's nothing wrong with you worrying about it. It's okay for you to look for information. The important thing is to look in the right places for the right information so you can make the right decision.
That can be so hard sometimes, sorting out the, reliable resources. Mm-hmm. So would you say something similar, I'm assuming, Dr. Myers?
Yeah, I would say trust your doctor, trust your child's pediatrician or your family doctor. Trusted websites such as the CDC or the American Academy of Pediatrics or even our own Children's Mercy website has a lot of great information out there that can help answer some of those questions parents have.
What kind of side effects are you seeing currently with some of the research you're doing, whether it's in the teenagers who've already had approval for vaccinations or some of the young ones you're working with, Dr. Pahud?
Well, with depending on which vaccine you're using, you're going to see a slightly different profile of side effects, as you have probably heard in the news. Most of the vaccines that we're giving for COVID have similar safety profile as all other vaccines for children. So sore arm, a little bit of fever, feeling tired after you've received it, and nothing that should stop a parent from giving the vaccine to their child. Those are the most common side effects.
And one of the things we hear about in the news, as we talked about it, is the extreme cases of the side effects that can be very scary and can probably add to some of the hesitancy or resistance to taking the steps to get children vaccinated and maybe even themselves vaccinated. What can you say about some of those more rare side effects and why maybe that ought not to be a barrier to getting the vaccine?
Yeah, that's a great question. So more people develop myocarditis or pericarditis, which is inflammation of the heart muscle or the lining of the heart, from having COVID disease than they do from the vaccine. So there's been a very small number of cases of that heart inflammation from the vaccine itself. And mostly it is gone within a few days and is well treated by nonsteroidals such as ibuprofen or naproxen and things like that.
mRNA. Tell me a little bit about that and why it's relevant in this conversation.
So the new vaccine platform that we're using to give the COVID vaccines used by both Moderna and Pfizer is the messenger RNA technology. So in the past, most of the vaccines we've used, like the varicella vaccine, measles vaccine, those are live viruses that we attenuate basically and weaken the virus and give it to you. The other types of vaccines we used in the past were protein vaccines, and that's how we got rid of most of the meningitis cases in children, things like that. But messenger RNA is a new technology. The only vaccine right now that is in use is the COVID vaccine, but multiple others are probably going to be developed with the same technology because we have learned how fast and how well it works.
One of the other questions I hear asked is, are there any long-term side effects? What do you guys both say to that? I'd start with you.
So when we do clinical trials, we usually look for side effects, and the side effects that we vaccinologists worry about are usually in the first month. And from what you've seen in the past year, you would see that it's true. When we started finding out cases of anaphylaxis, those happen 1-2 days at most after the vaccine. When we started hearing about the Johnson & Johnson and the AstraZeneca vaccine having clots, that happened in the first week, 2 weeks. When we started hearing about the myopericarditis, 1 week, 2 weeks. So everything happens usually in that first month, which is why the FDA has said we want 2 months of data, basically double it up to make sure that it's safe and that we didn't miss anything. But long-term side effects, like years after a vaccine has been given, we've been doing vaccine research for decades now, and there is no such thing. The things that people are afraid about, such as it will change my DNA, that is not true either. And if we had time, I would explain that, but it's not. Or infertility issues, they've all been addressed. None of these are true. And a lot of these rumors, unfortunately, are fueled in social media channels to target people to make you afraid and prevent you from getting the vaccine.
There have never been any long-term side effects from any vaccines that we have and we use widely today.
Is there truth to then the people who say, I'm going to give it a few weeks, or I'm going to give it a little bit of time to make sure that those kinds of things are worked out before I take it? But you're saying a month is good enough.
A month is good enough.
Okay.
And we've got, thinking about this, the original trials that started in adults started last year, a year ago this month. If there were side effects that were outside of that time frame, we would know about it by now.
Mm-hmm. So we've all heard some of the different theories or different things said. Pregnant women, any threat of a vaccine to a pregnant woman?
No, as far as we know, there's been, like I said, studies that are randomized controlled clinical trials. So we give the vaccine to some of the participants and not to others. The outcomes of pregnancy in both have been equal. Both of them are getting equally pregnant. Both of them are having babies equally. Both of them are equally having miscarriages. So getting the vaccine does not protect you from having a miscarriage. So you may have in your future a miscarriage whether you get the vaccine or not. Where people get confused is you may get the vaccine, have a miscarriage, and blame it on the vaccine, right? That's why we do the clinical trials, so that we can compare at a population level whether that is higher in the vaccinated people than it's related, or if it's equal, it's just life. The vaccine does not protect you from life.
From things that would happen anyway.
Yes.
And the other thing pregnant women need to know is that when they get vaccinated while pregnant, the baby gets some antibodies from mama. So the baby gets some passive transfer from being in the womb and has some at birth, which is wonderful. That's why we want pregnant women to get flu shots every year.
What about breastfeeding? Does it pass through with that as well? And are there any risks from a breastfeeding mother?
There actually is some passive antibody transfer from breastfeeding, and no, there isn't a risk. It is encouraged for breastfeeding moms to get vaccinated.
Any early indications of any issues for babies with COVID and or COVID vaccine?
Well, babies could have problems, obviously, if they acquire COVID. So the other thing I was thinking about the breastfeeding is if a mom is vaccinated and she has a baby nearby, it decreases the chances of her passing COVID to the baby. So you're protecting the baby through immunization, not just by passing immunity, but preventing the baby from acquiring it by cocooning the baby.
We've heard a lot about the Delta variant. Can you guys each talk a little bit about the Delta variant? I'll start with you, Dr. Myers.
Sure. What I've been telling people is that the Delta variant is even more contagious than the Alpha variant, which was the very first variant we saw that really took hold in the United States, kind of like wildfire, and became the most predominant strain back in March. So if you think about that, the variant that we have that's taken hold of the US now, which has become the predominant strain, is even more contagious than that variant back in March. I think we all need to kind of think about that in our brains as we move forward throughout the rest of the summer and into the school year.
Dr. Pahud?
My biggest concern with the variants is that the virus originated, the original virus, let's call it, that started this all. Then we developed vaccines. Then the virus, just like us, wants to stay on planet Earth. It needs to mutate, evolve to stay alive. So if all of a sudden humans have this vaccine that is protecting them, the virus needs to figure out a way around the vaccine. Does that make sense? So as long as people continue to not immunize themselves, not get the vaccine, the virus can infect them, mutate, and find a mutation that gives it an advantage to infect people that are already vaccinated. That can only happen if there's enough humans that are not vaccinated where the virus can basically use them as a lab and find a new mutation. So my concern is, as the virus has evolved from alpha, beta, delta, it has continued to be protective, the vaccine, against the variant, but it's starting to lower its efficacy. So my worry is, as long as we continue to have unvaccinated people out there, there's a potential that this virus, let's say you didn't get the vaccine, you may have an asymptomatic infection right now, and your virus may be figuring out how to infect me and Angie, even though we are vaccinated, and the moment we leave this office now, we're both infected because it's a new virus, a new mutant.
Hearing that, there are people who had the vaccine and are now getting COVID-19 again. Yes. Are we seeing an end to the vaccine's efficacy? Is it 3 months? Is it 4 months? Is it 6 months? Are we seeing an end to that? Or are we just seeing a mutation?
So there's multiple things that are happening there. People may be getting COVID after they've been vaccinated, but if you look at the data, the people that are getting COVID after they're vaccinated, either they have a weakened immune system, so the vaccine didn't work in them, like they had cancer, or they had some reason that their immune system did not mount a good enough immune response to the vaccine. So they got COVID because the vaccine wasn't efficacious in them. That's why we have these efficacy rates. There's always going to be somebody that just doesn't respond. So that's one. Number two, let's say I have a healthy immune system and I have COVID again. Most people that are catching COVID that have a normal immune system are just catching a very mild case. The purpose of the vaccine is not to prevent any COVID. It's to prevent you from dying or landing in the hospital, which is the same thing that happened with flu vaccine. So if you have COVID and all that happens to you is you have a sore throat and you sneeze, I'm okay with that. The purpose is to keep you out of dying and from the hospital. The biggest proportion of people that you're seeing in hospitals right now are unvaccinated people that are catching COVID. So as you have seen in the news and heard, COVID right now is a disease of the unvaccinated. So even if there's 100 people hospitalized with COVID, one might be because it was a vaccine failure, and all the other ones are unvaccinated people where the virus, think about this, has a chance to mutate and figure out how to reinfect all of us who are vaccinated.
We've heard so much about the vaccination for adults. The focus now on, there were teens, and now it's on young children. The importance of having all age groups vaccinated, how important is that to herd immunity?
Well, it's incredibly important to herd immunity because infection can be spread from adults to kids and kids backwards to adults. It's also incredibly important because we want kids to be together in school. And the best way to do that is to get everybody vaccinated. You know, to protect each other so that kids can't pass it to each other, kids aren't passing it to teachers, and vice versa.
It's really important to a lot of parents as well, I'm sure. Thank you, Dr. Myers, Dr. Pahud, for being here today from Children's Mercy, Kansas City, for our COVID-19 Vaccine Safe series. To find out where you can get the vaccine, visit the website vaccinefinder.org. And then for more helpful resources, you can go to bluekc.com.